Hello, my name is Russell Myers. Welcome to Issues Unite. So, I am sure that some of you have been waiting on this one. So, one major thing that would help with stabilizing our economy in the long term would absolutely be implementing universal health care. So, let's start with some of this. All right. When you pay your insurance premium, some of the things that you are paying into which do not affect how much gets spent on medical care at all. Some of these expenses are corporate executive pay, stock buybacks to increase share price, stock dividends, advertising to the tune of tens of millions of dollars per day for the insurance industry, insurance agent premiums. And guess what? The insurance companies also get to claim most of these things at least, as expenses so that they pay less in taxes. So if you diverted the money from just these things, then the amount of money that could be spent on medical care would rise tremendously. Yeah, probably by 50% of what is going into the insurance industry right now, today. So, what are some of the ways that this would benefit business? Well, first of all, if you implement universal health care, then small businesses and medium-sized businesses would be better able to compete for workers, for qualified workers who will not take a job with a small or medium-sized business that does not offer health care as a benefit, and instead that person will take that job. I myself would prefer working for a small or medium-sized business rather than a corporate entity. And so these small and medium-sized businesses would see their cost decrease, not increase, decrease, because they wouldn't have to be paying for insurance benefits if they offer them. So, in addition, people that are between jobs would not lose their coverage. Industry loses tens to hundreds of billions of dollars a year in lost productivity because of illness. A huge percentage of those illnesses are preventable. In rural areas, we have seen an average of 35 hospitals close every year in the United States for decades now. We have fewer hospitals in the United States today than we had in 1974. You can look these numbers up and confirm them for yourself. So we would see more hospitals either stay open or even new hospitals open in rural areas if their income were going to be stable because of universal health care. When a rural hospital closes, you don't just see just a few jobs at the hospital that close down. You lose a lot more. You see medical professionals that are highly likely to leave that area if they're far away from another medical facility where that person can work. you see doctors, nurses, respiratory techs, x-ray techs. They leave these communities. In addition, now you've lost the buying power, the consumer spending of these professionals in that community. So you see also outside support services, food delivery, and maintenance from outside lose business. So then you see from the lost consumer spending, restaurants lose business, local small businesses lose revenue. So you can see a large portion, if not an entire community, collapse because of the closure of a hospital in a small community. So I fail to see why anyone would oppose this unless they are an insurance executive or have huge investments in insurance companies. Millions of Americans declare bankruptcy every year because of medical bills. But even if you don't declare bankruptcy, all right, so if you're paying $30,000 a year, well, let's say $5,000 a year on insurance. That's $5,000 a year that you are not spending in the general economy. If you have an acute medical issue that costs you tens of thousands, hundreds of thousands of dollars, well, now you have incurred debt. Until you pay off that debt, that is money, tens to hundreds of thousands of dollars that you are not spending in the general economy. Who's most likely to be affected by this? Small and medium-sized businesses. You stop people from, they will avoid buying a new vehicle. They will put aside repairs or improvements on their homes. They will not buy new clothing. They don't go out to eat because all of this takes away from what they have to pay on medical debt. As far as the medical insurance, medical costs themselves, we pay more toward medical care than any other industrialized nation, in the world at this time. Even Mexico has universal health care at this point, and they have had since 2012. So, by eliminating these costs, then yes, the economy would absolutely stabilize and improve. Look at acute, widespread health crises like the pandemic going on right now. How many people are incurring debt right now, have incurred debt in the last year and a half that is going to take them years to pay off. And that means they're not going to be spending that money in the general economy. Where is the argument here? There is no argument here. I don't want the government making decisions for me. Medicare has a far better medical outcome than any insurance company at all for patients. Medicare sets standards. Without Medicare setting standards, laparoscopic surgery would not have become popular. Doctors opposed using laparoscopic surgery as opposed to opening a person wide up to do surgery for things like gallbladder removal, appendectomy. These are things that are done laparoscopically now that used to cause a person to be cut wide open. Because of Medicare, these surgeries, these procedures have been made mainstream, even though the doctors opposed it. Medicare came in and said, if you do not do this, you won't get paid. So there are many things, many ways in which Medicare has improved the care in this country, which would not have happened otherwise. So when you oppose, the government making a standard, which is always based on evidence-based criteria, they demand that research be done before they adopt any standard. I have worked for insurance companies doing pre-authorization for radiology studies. I wound up quitting that job because they changed the standards to try and deny as many studies necessary, medical imaging. They tried to deny as many as they could. So, but you're fine with a corporation making these decisions while you don't want the insurance companies who make their determinations not based on evidence-based criteria, but based on their profit motive. Yes, implementing universal health care would stabilize the economy tremendously by cutting out expenses that don't need to be spent and paid for. I don't have insurance right now because it would cost me, many thousands of dollars to pay for the insurance, and then I would still have to meet the deductible on top of that. So if I pay $3,000 a year for insurance, let's lowball that, and then I have a $3,000 deductible, again, lowballing that, I've paid $6,000 before the insurance pays a freaking penny. That is at least $6,000 probably that I could spend in my local community and support small and medium-sized businesses. So why would you oppose this? People that call themselves capitalists are most often just brainwashed puppets. You look at your stock portfolio and you're willing to allow other Americans to suffer and die. But you probably go to church on Sunday and call yourself a Christian. All right. If we keep putting this in terms as to how this would benefit the economy and small and medium-sized businesses, how it would create and maintain tens of millions of living wage jobs, which means consumer spending. This is how we battle this. We've already proven that the humanitarian approach is not going to work. So let's put it in terms that they understand. If you don't understand this, then you're too stupid to breathe. All right, share this video. Talk about these subjects far and wide. If you can, please donate $1 a month to help expand the channel, and I will catch you in the next one.